morning, Mr. President of the European Association of the Hospital Pharmacists, EAHP. Thank you for honoring us with your presence here in the 16th Health Expo Athens. I would like to ask you a few questions about, firstly, how do you see generally the map of the European map of the hospital pharmacist?
First of all, thank you for the invitation. It's really a pleasure to be here. And if we talk about hospital pharmacy map nowadays in Europe, it's a driving forces of change in terms of electronic healthcare records, patient safety, advocating for patient-centered care. We really want to collaborate intensively with physicians and nurses. We want to provide patients the best possible care, and the only way we can really do it is as an association which really do a lot in terms of health policy development in Brussels and across all European countries. And we really do hope that the artificial intelligence, the electronic health data space, and everything what's going on in Europe at the moment will only help us to reiterate the importance of patient-centered care. So that's really the driving force of hospital pharmacists in Europe.
This is great, thank you. You also talked about assistance between nations before, and I would like to ask you, how do you see the golden points of the synergy between the countries, between Latvia, Greece, Spain, Italy, and the whole European nation in order to drive forward the hospital pharmacy and the health aid in the whole Europe?
Thank you. That's a very good question. So EAHP strongly believes that only through harmonized approach and coordinated actions of all hospital pharmacists in all European countries, we can really achieve the goal, which is progress in providing high-quality healthcare services in hospitals. So it's exactly as you said. You invited pharmacists from Spain, from Italy, from Latvia. You show really an example of good collaboration practice. In this very particular case, it's antimicrobial stewardship, knowledge and practice exchange. So EAHP really supports cooperation between countries and strengthening collaboration among hospital pharmacists, including our lovely colleagues from Greece.
That's beautiful. Thank you for the kind words on behalf of the Greek colleagues. And I would like to ask you, lastly, what are the positive points that you see on inside the Greek hospitals of the Greek pharmaceutical hospital pharmacists?
Well, I can only start with the president of PEFNI, Dr. Despina Makridaki, and I see what tremendous change she has implemented since 10 years ago, I would say. Hospital pharmacists in Greece are really doing their best to increase collaboration with primary care level, with physicians, nurses, and I also know that PEFNI is doing a lot in terms of development healthcare policy in Greece. So I think that bright future is waiting for Greek hospital pharmacists, because you really want to move. You want change, you want progress, and I think eventually you will bring benefit to patients in Greece. Thank you once again for this lovely invitation.
Thank you very much, Mr. President.